Hi, my name is Roger McCann, and I'm the audit manager that led the team who produced our report on workforce planning for nurses and midwives. Today, I want to briefly talk about that report and discuss why we chose the topic and some of the key findings coming out of our audit work. So, firstly, why did we look at the topic? Well, workforce is one of those major strategic issues that much of the public sector is grappling with, not solely in terms of numbers, but how organizations can ensure they have the right people with the right skills in the right place at the right time. The challenges are evident right across the public sector, but it's particularly important in the health and social care sector. Why nurses and midwives? Well, in terms of cost, they're the largest single group within the health and social care sector, and around 1 in 3 staff in the sector is a nurse or midwife. Importantly, in terms of patient outcomes, nurses and midwives often have the largest amount of contact time with patients. We should also point out the challenges in this area are well known. Northern Ireland exists within a global context. There's a shortage of nurses not just in the UK, but worldwide in developed countries. So Northern Ireland is therefore only a small part of the global marketplace for trained nurses. Our audit work has shown that workforce planning is, by necessity, a long-term process with the aim of ensuring there's a supply of appropriately skilled staff to provide care for those who need it. That includes dealing with shocks to the sector, and of course, the recent coronavirus pandemic has been a shock like no other. Whilst we had carried out our audit work before this outbreak, now, more than ever, the need to have appropriately trained and skilled staff is clear. So that's why we looked at the topic. And here's what our audit found. We've distilled this down to 3 key findings. Firstly, the demand for care is increasing at a much faster rate than the increasing number of nurses in the system, meaning many posts are now vacant. Secondly, whilst workforce planning must be a long-term process, short-term decisions were taken to reduce nursing training places. And finally, the consequences of those decisions have had significant long-term costs that the sector is still coping with. So to focus on some of those. The demand for healthcare has increased over the last decade, and all available projections indicate this will continue. The Northern Ireland population is growing, and it's also aging, which will result in increasing demand for care. The number of those diagnosed with long-term conditions who are likely to need continuing care has also increased. And there are clear signs that the system is struggling. Growing waiting lists alongside growing numbers of hospital admissions. To cope with these increased demands, the health and social care sector has employed more nurses. Numbers employed have increased by almost 9% since 2012. But this hasn't been sufficient to cope with growing demand. During our audit, we calculated that, assuming similar delivery structures, workforce levels would have needed to grow by more than 20% to keep pace with demand. So in light of this rising demand, it's unsurprising that the number of vacancies has risen sharply. In 2012, there were 725 nursing and midwifery vacancies in Northern Ireland. Whilst there will always be some degree of staff turnover in a workforce of this size, by the end of 2019, there were over 2,750 vacancies. The majority of these, more than 2,100, were for registered nurses. And that means that now around 11% of all registered nursing posts, that's 1 in 9, are vacant. Alongside nurses, nearly 10% of nursing support staff posts are vacant, and more than 6% of midwife posts. And these are only the vacancies within the health and social care sector. There are also likely to be a significant number of vacancies in the independent sector, again likely for registered nurses. However, despite the fact that it's the Department of Health that commissioned a number of training places for pre-registration nurses, to date the department doesn't have sufficient information to enable them to accurately capture the sector's staffing needs. The training of a nurse takes 3 years, and further post-registration training to specialise in specific areas. So workforce planning decisions need to be taken years in advance of those staff actually being needed. In contrast to this, however, budgets to pay for both staff and staff training are much more short-term. They're based on meeting annual limits. And it's this mismatch between the long-term planning needs for workforce and the short-term needs to reduce annual budgets that led to a cut in the number of pre-registration nursing places in 2011. In the face of financial pressures at that time, with the aim of reducing annual spend, The department reduced the training budget by around £1.3 million a year between 2011-12 and 2016-17. Altogether, over the period, over 730 fewer training places were commissioned over those 6 years from April 2010 in comparison with previous levels. Whilst that made some short-term savings to the training budget, the reduction has had significant impacts overall, and in our audit, we've chosen to look at these impacts through a few lenses, including an increased reliance on temporary staff and rising rates of agency spend. We discussed earlier rising vacancy levels, and in light of this, it's unsurprising that reliance on temporary nurses has increased. In addition to being much more expensive than using permanent staff, evidence suggests using temporary staff to provide cover can be less likely to lead to satisfactory patient outcomes. Spend on temporary staff has increased from almost £15 million in the 2006-07 financial year to £115 million by 2018-19. That's an increase of more than £100 million a year in just over a decade. Not only is more being spent in total on temporary staff, but these costs are taking up an increasing proportion of the overall budget. In the last 7 years, it's increased from around 6% of the nursing budget to more than 13%. So now, more than 1 in every £8 spent on nurses goes on temporary staff. These temporary staff are either drawn from Health Trust's own internal banks or from external employment agencies. Spend on agency staff is a more expensive option, but it's this option that has been increasing fastest. Annual agency spend has increased from £8.6 million to over £50 million a year in 2018-19. This increasing spend on agency staff clearly does not provide value for money. That's illustrated by the rates that health trusts are having to pay, up to £1,700 for a single nursing shift. Whilst the department formerly had targets to reduce reliance on temporary staff, these haven't been achieved. Workforce planning is an incredibly complex discipline, and there are also a number of other factors impacting on the nursing and midwifery workforce. The workforce is increasingly ageing, with significant proportions of staff in key fields of nursing practice and managerial positions potentially able to retire within the next 5 to 10 years. Given the demands placed on staff, absence rates in nursing have also been higher than rates in the health and social care sector more generally. The department has recently taken action to address some of these challenges. In 2018, an updated workforce strategy was published, outlining the actions the department would take to improve workforce planning. In addition to the publication of this strategy, the number of training places has recently significantly been increased. 746 places commissioned in 2016-17 will increase to an average of 974 a year over the next 4 years. The number of midwifery training places will also increase. As well as pre-registration places, the budget available for post-registration training has also been increased, allowing more experienced nurses to undertake specialist training. And in addition to local recruitment, there's also been a programme of international recruitment. This has resulted in the appointment of more than 450 staff who were still in post at March 2020. So action is now being taken, but given the length of time it takes to train a nurse and the current demands in healthcare, it's likely to be some time before we see significant progress. And given the number of vacancies currently, it's also likely that any future progress will have at its heart transformed services. Simply recruiting more people to prop up outdated modes of service delivery is unsustainable. So our report is clear that sustained investments now required in training new staff alongside work to ensure the health and social care sector is a rewarding place to work, to ensure those staff who are employed feel able to stay. It's this long-term action that's now essential to stabilise the nursing workforce.